Hi, my name's Ani, and today I'll be discussing elbow fractures for my individual project. More specifically, I will be discussing medial epicondyle fractures of the humerus. Your medial epicondyle is on the inside of your arm, and when you rub back and forth on the inside of your arm right near your elbow, it's that protrusion right there. That is your medial epicondyle. This fracture is very common in children from the ages of 7 to 15, and medial epicondyle fractures actually make up about 10% of elbow fractures in children. This fracture usually comes from when you land on outstretched hand or an arm just like this. For me, when I broke mine, I was this girl right here in the middle doing gymnastics, and I fell in a handstand and I landed on two outstretched arms, but luckily I only broke my left one. Signs and symptoms to look out for is that it will be painful, so you'll feel some pain. There will be some swelling too around the fracture site, and that there'll also be some point tenderness right near the fracture site as well. For the coach, when they have watched this, it's important that you stay calm, and because that will keep the athlete calm as well. Try to splint the arm to make sure it doesn't move too much and keep it immobilized, and to make sure you activate your EAP and call someone to call the doctor so that you can get that athlete to the doctor as soon as possible for further evaluation. Usually the treatment options for this depend on if it's a non-displacement or a displacement fracture. So if you have a non-displacement fracture on your non-dominant hand, they recommend that you just stay in a splint or a cast for about 3 weeks. And if it is a displacement fracture on your dominant hand, they recommend surgery. I was recommended surgery, and I had a surgery, and I have a screw in my elbow right about here, and I have been fine ever since. And I would just like to thank you, Professor Custer, for making this semester so nice and informational, and I hope you enjoy the rest of your 2020.